But tonight, our big focus. First, it was COVID, and now it is the black and now white fungus infection scare. Not just that, cases of an even more dangerous yellow fungus scare have been reported in some parts of the country. Experts warn that yellow fungus is even more fatal than black fungus, and in some cases can even lead to organ failure. Now, all of this is happening at a time when several governments are throwing up their hands, saying they just don't have the drugs to ensure treatment for black fungus. Has the government, both at the center and states, been caught off guard? We'll be talking about that in a moment. But first, take a look at the scare now from black fungus to yellow.
After black and white fungus, risk of yellow fungus now looms large for the COVID infected. A 45-year-old patient in Ghaziabad has now been diagnosed with all three fungal infections.
कल एक पेशेंट मेरे पास आया था संजय नगर से, कुछ साइनस बिल्कुल सीटी स्कैन में नॉर्मल लग रहे थे, लेकिन जब मैंने एंडोस्कोपी टेस्ट किया तो उसमें मुझे मालूम पड़ा कि उसको 3 तरह का फंगस है, उसको वाइट भी है, उसको ब्लैक भी है, उसको येलो फंगस भी है। इसको एम्फोटेरिसिन इंजेक्शन ठीक कर सकता है, लेकिन ठीक होने के बाद इसका घाव भरने में समय लगता है।
Lethargy, weight loss, low appetite are said to be the symptoms of mucoseptics or yellow fungus. Experts call this equally fatal, like in the case of black fungus. And like black fungus, amphotericin B injection is the only treatment for yellow fungus. This private hospital of Ghaziabad is treating 26 patients with black and white fungus. Varanasi too has recorded its first case of white fungus. A 72-year-old patient has lost vision partially after the infection.
Yesterday, a patient presented to me who had a history of admission in Delhi hospital post-COVID. He was admitted for 8 days in the month of April and he was discharged on oral steroids. Around 10 days back, he experienced some floaters in front of one of the eye and mild haziness in the vision. On clinical examination, it appeared to me that the whole eye has been infected with fungus.
Experts advise to keep the surroundings hygienic, removing old and decaying waste from home and maintaining humidity levels with help of a humidifier to keep these fungal infections at bay. Regular monitoring of blood sugar levels is crucial. Bureau Report, India Today.
The big question, does India really have a plan to combat black fungus? What caused this black fungus outbreak? Has the treatment protocol been marred by confusion? The focus now on black fungus. Joining me now is Dr. Randeep Guleria, the All India Institute of Medical Sciences Director, member of the National COVID Task Force. Appreciate your joining us, Dr. Guleria. Would I be right in saying that the government, both at state and centre and indeed hospitals, was simply not prepared for this black fungus outbreak? It's caught everyone out off guard and the governments are now scrambling for solutions, as are doctors.
So thank you very much, and Rajdeep, let me start by wishing you many happy returns of the day, because I believe it's your birthday today.
Thank you very much, Doctor. I had you, if you remember, a few weeks ago on your birthday. Today is mine. But go ahead.
Okay, so coming to the issue of mucormycosis, if you look at mucormycosis as a fungal infection, it had been reported during the first wave also, and also has been reported during the SARS outbreak in 2002-2003. But no one really expected that the number of cases would be so exponentially large. And that is what I think has caught a lot of people off guard. One was expecting that you would see some cases of mucormycosis, as was seen during the first wave also. But the numbers that we are seeing right now is very large. In our hospital itself, we have more than 100 patients admitted with mucormycosis. And this is becoming a big challenge because some of them are COVID positive and some have recovered and are COVID negative. So you're having to sort of treat them both in a COVID positive and a COVID negative ward. But the number is something that has really caught people by surprise. One was expecting to see some cases of mucormycosis.
No, but the question is why India? You know, the question that's being asked is why India, particularly in the second wave? Yes, we've seen some cases in Pakistan, but not to the same extent. What explains this exponential rise? Because all kinds of theories, Dr. Guleria, are floating around, from excessive use of steroids to sugar supply, to sugar issues, to issues of the hygiene. Which is practiced in certain hospitals, especially with oxygen cylinders. Do we have an explanation for this exponential rise?
So you're right, the majority of cases are being reported from India. If we look at a review which was done about a month ago, 70% of cases of mucor being reported were actually from India itself, and only 30% were from outside India. Now, there are multiple factors for this. One factor, of course, is that India is the diabetic capital of the world. And we do know that we have a large number of people who have diabetes with very poor control. And that is one risk factor which we need to really understand and accept. The second issue is that we have a lot of drugs which are available over the counter. And many people start steroids on their own, continue it for a long time. Today, we saw a patient who was continuing steroids in high dose even after discharge on his own and had gone on to develop mucormycosis. So there are prescriptions which are followed on your own based on the advice of a friendly neighborhood person rather than doctor's advice. And of course, thirdly, we are seeing a huge exponential number of cases as far as COVID-19 is concerned. So larger number of cases, more uncontrolled diabetes, more use of steroids. In absolute number, the number of cases of mucor will be more.
No, the reason, doctor, let me press you on that, is during the first wave of COVID also, India's always had, India's been the diabetic capital of the world. That's not happened in 2021. Steroids were also being prescribed in COVID-1. Why now? The question is why now? What has changed to make black fungus so prevalent in 2021?
So I think what has changed, if you were to look at it critically, because the virus is the same, we had COVID-19 during the last time also. I think the panic which we had this time as far as COVID is concerned led to a lot of excessive use of steroids. Let's be very frank that people have been using steroids from day one, and this is something that we've been saying repeatedly, that you don't need to take steroids. Even the recovery trial classically showed that when steroids were taken early, it had a worse outcome because it led to secondary infection. And these were all bacterial and fungal infections. So despite us knowing that steroids in the early stage can predispose to fungal infection, especially with the background of diabetes, it can be very harmful. There's also some data coming in which suggests that COVID itself can affect the beta cells in the pancreas, and during the phase of cytokine storm or otherwise also lead to a stage where your sugars tend to be high, and therefore can also predispose to people having high sugars who didn't have underlying diabetes but were borderline and then now start having very high blood sugars.
But I have to ask you this, doctor. You're saying that there is this indiscriminate use of steroids, particularly in COVID 2.0. But who did so? I mean, many doctors have prescribed it. Even All India Institute of Medical Sciences, sir, your guidelines in early April seem to suggest that you will need these antiviral drugs. The concern is that maybe mixed messages went out there. People got desperate. Doctors prescribed steroids. The National COVID Task Force also didn't say right at the very outset, don't use steroids. Everyone seemed to panic. We saw that with Remdesivir also, doctor, that at times, this was part of your prescription manual a few months ago. Now people are saying don't use Remdesivir. Did we get something wrong somewhere?
No, I don't think so. Even if you look at our initial guideline, and these guidelines have been there for more than 6 months, they always said steroids are required only for moderate illness, for those people who are having fall in oxygen saturation or who are having infiltrates on the chest X-ray. None of the guidelines, because this was the data which came out somewhere in the middle of last year, classically showed that giving steroids early would not be of much use. What actually happened was that there were 2 or 3 things. One was a panic reaction. One was a lot of blood tests being done and biomarkers being done. And many people, rather than looking at a person's clinical state or his underlying oxygen saturation, looked at biomarkers. And if they found CRP is high or IL-6 levels are high, they immediately started steroids. So despite the guidelines really not saying that you should, not recommending use of biomarkers to guide treatment. So once you start doing a lot of tests and you find some tests suggesting some abnormality, either the doctor or the patient in panic starts taking drugs which are not indicated. Biomarkers will be elevated in any inflammation. These are what we call acute phase reactant. But if your CRP is high, that is not an indication for starting steroids. But that was what was happening in the last few weeks or months. And that, I think, has caused a lot of use of steroid which was not required.
No, the point I'm trying to make is somewhere, doctor, should someone take responsibility for the fact that the guidelines were not specific? For example, the management of COVID-19 AIMS Delhi 7th April 2021 seemed to suggest for moderate and severe diseases, you will need antivirals. They will be needed. Now, as a result, maybe some doctors interpreted that to mean it may be needed right at the early stage, was used in excess. But where is the template in this country, sir, at the moment for a consistent treatment line for COVID-19? I mentioned remdesivir. Remdesivir was being suggested. There was a time where ivermectin was suggested, particularly for mild and moderate cases. And then ivermectin, the WHO said not necessary. We've seen a lot of U-turns being made on plasma. The point I'm making, should there be consistent guidelines so that doctors are told what to use, when to use, and what quantity to use?
So all guidelines are what we call living documents, because let's accept the fact that COVID-19 is only about 1.5 years old. And what we know about it is an evolving science. We started off, when we started treating COVID-19 more than a year ago, we were giving hydroxychloroquine. It was actually something which was touted even in the US. They said hydroxychloroquine is the drug which will help us cure COVID-19. We were giving anti-HIV drugs like lopinavir, ritonavir. As more and more data emerged, we realized that there are some treatments which are not of much use and they got dropped from the guidelines. Some treatment strategies turned out to be better, like steroids. They got added in moderate to severe illness. And that is an evolving science. Now we're looking at newer drugs which we may be able to bring in as far as antivirals are concerned, monoclonal antibodies. But this is an evolving science. I can't say that what I'm prescribing today will sort of be something which is required tomorrow, or we may have a better treatment, or we may have against it. So that is why the treatment strategy will evolve. And I'm not saying that this is the best treatment strategy. It is something which will evolve with time. And as it evolves with time, the guidelines will get changed. Okay, the guidelines can never be written in stone and can never be permanent.
Okay, you're saying guidelines cannot be written in stone, but the worry now, doctor, is that as these cases expand, where are the drugs? Because you need amphotericin B to treat black fungus. You need those injections, you need those vials. They are very expensive. They can cost up to 6,000 to 8,000 each, and a patient diagnosed with mucormycosis requires anything between 90 to 120 vials. That cost, as I said, between 6,000 and 8,000 each. That's a lot of money. And in many states, there is no amphotericin at the moment. Maharashtra is saying they don't have it. MP is saying they don't have it. Rajasthan is saying they don't have it. So we've got a problem of demand and supply once again, which is setting out, which is only furthering the panic. And they need these life-saving drugs. Do you see a solution?
Yes, I think there is a solution. We started off with very limited companies making amphotericin because before this, amphotericin was not used that much. And now what has happened is a large number of companies, Indian pharmaceutical companies have been roped in to start making amphotericin. So I think not only the generic amphotericin, which would be available in our country, but even other forms which are made by a company called Life would also be available. It comes by the name of Fungizome, and the liposomal amphotericin comes by the name of Ambizome. So I am hopeful that in the coming days, we will have more and more stock available. But you do have a point that at this point in time, considering the sudden increase in number of cases across the country, there is some degree of shortage in terms of long-term availability. It's something that people are getting on a day-to-day basis or only on 2 or 3 days doses rather than on regular supply because of the fact that it needs to be spread out across the country. But I'm hopeful that over the next few weeks, this will settle down.
You know, I know, I mean, we're all hopeful over the next few weeks, but the number of patients mean that, you know, a lot of people could lose their lives while waiting for these drugs. The larger question also, doctors, you said excessive use of steroids. You mentioned diabetes. The fear also is that repurposed oxygen cylinders, industrial oxygen cylinders being used now for medical oxygen, hygiene quality is uncertain in certain hospitals. Could that be a factor why these cases are rising?
So there is no data to suggest that. And if we looked at data from India, there are about 10% of patients who get mucormycosis even when they have not been on oxygen. So there were patients who were on home isolation. They were getting treatment at home without oxygen, but were getting steroids and had high blood sugars. But they also got mucormycosis. So I don't think there's enough evidence to say that industrial oxygen is causing this. It's something that can be looked at. But having said that, if you're using any cylinder at home for oxygen or any hospital, infection control practices in terms of keeping things clean and preventing infection are very important. That's also true for the tubing that you tend to use, or for the solution that is used for humidification. All of this has to follow standard infection control practices, which are there available with most guidelines, and most hospitals, one assumes, will follow them.
You know, I don't want to scare our viewers, Dr. Guleria, but according to some doctors, more than 80% of the patients in mucormycosis need surgery immediately. Patients are not treated in time and properly. Mortality rate can go up to as high as 94%. Cost of treatment expensive. Drugs in short supply. Is the black fungus and now possibly white and yellow fungus going to become more challenging than COVID-19, doctor? Is the government aware of the fact that this is possibly going to be an even bigger challenge in the weeks ahead?
So 2 or 3 things. First is, I think one gets very confused when we use these names like black, white, yellow, green fungus. It's better to use the name of the fungus per se, because even mucormycosis by definition is not a black fungus.
Right.
It's basically white in color, which has these black pepper dots on its culture media. And by definition, therefore, we are creating more confusion by using color coding rather than the actual name. Secondly, I would really say that, yes, we are seeing more than expected numbers of cases of mucormycosis. The treatment is actually surgery along with the antifungal drugs, because debridement has to be done, especially if the fungus is deep in the sinuses or in the nasal cavity. If it is picked up early, then surgical intervention is less and it has much better survival. But if it is picked up late, when it has invaded, let's say, into the eye or into the brain, then you have a higher mortality. The third thing to remember is that it is linked with COVID-19. So as the cases of COVID-19 start coming down and we're seeing a downward trend in our country, it is expected that we will also see a downward trend in the number of cases as far as mucormycosis is concerned. It will follow the trend which happens with COVID-19 in terms of the number of cases.
So you're telling me very significantly that it will not outlive COVID-19. This is linked to COVID-19. As COVID-19 cases go down, you believe black fungus cases will decline?
Correct. Because this is the reason why it has really gone up. Before COVID-19, we would see mucormycosis occasionally. We would see 1 or 2 cases in a month. And that was not something that we would say was very common. But so we will probably come back to that stage in the coming weeks once we see a significant decline in the cases of COVID-19.
One final question, doctor. A lot of people are telling me amphotericin B side effects: fever, chills, pain, clotting at injection site, decreased BP, increased pulse rate, nausea, vomiting, liver damage, kidney damage, anemia. Am I scaring people again, or is this all possible?
No, none of this. Amphotericin B has to be given very carefully. It is a drug which has side effects. It has to be given properly in the drip, and and monitoring has to be done. One has been giving amphotericin B for a very long time without much problem. Oncologists will tell you that they give it routinely for the cancer patients who are having fungal infection because of their immunity being low because of chemotherapy. Post-transplant patients get amphotericin B because of the chances of getting fungal infection after transplant.
Right.
We give it in many of our patients who have pulmonary fungal infections because of the fact that they have uncontrolled blood sugars. So we've been giving it for years and have been able to monitor patients closely. So once it's given under close monitoring, I don't think there is that much of a worry of side effects.
One final question. Any regrets about the fact that we perhaps were not ready, be it for COVID-19 2.0, which we've discussed in the past, but today about black fungus? Are you going to say that could we have done something more to prevent what's happened?
So I think there are 2 or 3 things. One is maybe we have to have better communication in terms of treatment strategy so that people don't panic. I personally feel that in the long run, we have to really develop a strategy that prescription is done with in a proper manner, and we don't have drugs or good drugs like antibiotics, steroids available over the counter. India is a country where you can buy the most high-end antibiotics just over the counter without a prescription. And that has led to a lot of antimicrobial resistance. It's now leading to a lot of other superadded infection, because people will just go to the chemist without going to the doctor, ask for an antibiotic, and it will be given to them.
Okay.
We need to develop a strategy where there is a good control in terms of the prescription and prevent misuse of drugs.
Let's leave it there. Dr. Guleria, I appreciate that you've taken the time off to talk about black fungus to us. We'll, of course, keep coming back to you for your wisdom in the weeks ahead. But thank you very much for joining me at this moment, at a time when black fungus is something that is of growing concern. As I said, it's not just the infection. It's also the shortage of antifungal amphotericin B, which